Hi class, this is Dr. Shahada. In this video, I will be reviewing Chapter 5. I do want to remind you that you are responsible for reading the chapter as well as going over the PowerPoint presentation provided to you on the chapter. So in this video, I'll actually be jumping from the information presented to you in this week's module as well as the PowerPoint presentation that's for the chapter on medical technology. So here is the file for medical technology. And then here is another file where you will have all the terms presented in the chapter as well as the definitions. All right, so I am going to scroll further down since we have the beginning is actually information from Chapter 4. So we are going to be jumping to Chapter 5. Which is medical technology. So I'm actually going to jump to the slides right now and cover the information presented to you in the Some Information from the Chapter section in this week's module. All right, so let's go to the slides. So technology has really changed our lives. It's led to a reduction in complications and disability, increased longevity, but technology also imposes a cost burden on society. So the big question we're hoping to answer with this chapter on medical technology is technology worth the cost in relation to healthcare? So let's begin here with what is medical technology? So it's the practical application of the scientific body of knowledge for the purpose of improving health and creating efficiencies in the delivery of health care. So this includes the application of biomedical discoveries to provide more effective medical care, adaptation of discoveries in other scientific fields like physics, chemistry, engineering, computer science to the delivery of medical care. Nanomedicine is a new era still in its infancy, which involves the application of nanotechnology for medical use and the application of technologies to improve the structural elements of healthcare delivery. So this would include information systems, facilities and settings, and organizational arrangements. So let's see the next slide. So technology does not only include sophisticated machines and ultra-modern facilities, which I already explained in the previous slide. All right. So here we're looking at sophisticated diagnostic procedures. There's been a lot of benefits to medical technology. It's reduced complications again and disability. Medical cures have increased longevity. There's new drugs that have stabilized chronic conditions. There's been a lot of modern breakthroughs, tremendous amount of costly research in order to get to these breakthroughs. Once technology is developed, even more costs are generated. So we're looking at the cost of staffing, increased need for skilled professionals, facility upgrading, and demand from both consumers and providers for the utilization of the new technology. So once a new type of technology is out there, everybody wants to use it. So technology has really raised consumer expectations. This increased demand and utilization is due to the idea that the latest type of technology may be the best. It also has changed the organization of medical services. So many specialized services have become available in outpatient settings. We have technology that has fueled the specialization in medicine. And primary care and public health have received a secondary status, which is what happened here. The changes that were brought about due to medical technology. And the cost of healthcare of course, continue to increase. So here, number 3, driven the scope and content of medical training and the practice of medicine. Again, fueled specialization, contributed to healthcare cost inflation, which I touched on, and I also reviewed the rest of the points presented on this page. So let's go to the next one. So some examples of medical technology. Again, medical procedures, open heart surgery, tissue transplants, hip and knee replacements, diagnostic equipment. We're looking at CT scans and MRIs. And then equipment devices to render treatment, like a heart and lung machine, kidney dialysis, pacemaker. All right, so next we're going to talk about information technology. So information technology, or IT, deals with gathering, storage, analysis, and transformation of data. So it becomes useful information for healthcare professionals, managers, payers, patients, as well as researchers and the government. So IT departments and managers handle the continually increasing flow of information in healthcare organizations. So this involves, IT involves determining data needs, again, gathering, storing, reporting. IT departments play a critical role in decisions to adopt new information technologies that improve healthcare and organizational efficiency. So I already touched on what the IT department's role is. So I'm going to go to the next slide, looking at IT application, which falls into 3 general categories. So the first one is clinical information systems. So this involves the organized processing, storage, and retrieval of information to support patient care delivery. An example of this would be electronic medical records. Second, administrative information systems, which assist in carrying out financial and administrative support activities. Examples of this, or an example of this, would be financial management systems. And the last category is decision support system, which provides information and analytical tools to support managerial decision making. So this includes management decision support systems and clinical decision support systems, which are also known as CDSS. All right. Now, health informatics. So, health informatics is the application of information science to improve the efficiency, accuracy, and reliability of healthcare services. Health information goes beyond the use of IT by emphasizing the improvement of healthcare delivery. I want to make sure that you understand the difference between health informatics and information technology, or IT. Now remember, IT deals with gathering, storage, and analysis, as well as transformation of data, so it becomes useful information for healthcare professionals, managers, payers, and patients. However, health informatics uses IT, but goes a step beyond by emphasizing the improvement of healthcare. So unlike IT, health informatics generally applies to specific medical treatments such as cancer treatment, nursing care, imaging and diagnostics, consumer health, public health, clinical research, and the list goes on. All right. So here, health informatics includes nursing informatics, imaging, consumer health informatics, public health informatics, clinical research, bioinformatics, and pharmacy informatics. Now, the next topic we're going to be touching on are electronic health records. So EHRs are IT applications that enable the processing of any electronically stored information pertaining to individual patients for the purpose of delivering healthcare services. All right, now the next slide provides some additional information about EHRs. First, EHRs replace traditional paper medical records. The EHR information are used to coordinate care, routinely measure quality, or reduce medical records. And EHR systems allow accessibility to individual records online from many separate interoperable automated systems within an electronic network. All right, now the following slide provides four main components of a fully developed electronic health record system. So according to the IOM, or Institute of Medicine, a fully developed EHR system includes four components. The first one is collection and storage of health information on individual patients over time, where health information is defined as information pertaining to the health of an individual or health care provided to an individual. The second component is immediate electronic access to person and population level information by authorized users. The third is the provision of knowledge and decision support that enhance the quality, safety, and efficiency of patient care. And last is to support of efficient processes for healthcare delivery. So widespread adoption of EHR or EMR, electronic medical records, is another, it's also known as electronic medical records, will lead to major savings in healthcare costs, reduced medical errors, and improved health. So EHR systems require a large investment to purchase and implement the system. So this is a major challenge for small organizations. And as you can see with the LearnScape scenario assignment titled The New System, which addresses the topic of electronic health records, you can get an idea of how expensive it is to actually purchase and implement. Now, the Health Information Technology, Economic and Clinical Health Act, or HITECH Act, which was part of the American Recovery and Reinvestment Act of 2009. So this act earmarked an estimated $19 billion in direct grants to promote the adoption of EHR. So that's probably why you've noticed the last couple of years, many physician offices have been taking on the task of switching to electronic health records. And many physician offices or physicians were somewhat resistant due to how much work it would take to implement it, but it is slowly being implemented throughout the US. And here is a video. If you were to click on it, you can see that there's a hyperlink there. You can watch a little video, very short, on the HITECH Act. Now, in 2013, data from the annual National Ambulatory Medical Care Survey was encouraging. Nearly 80% of office-based physicians use some type of electronic health record system. That doubled in 2008. So the year before, the Health Information Technology and Economic and Clinical Health Act passed as part of the Recovery Act in 2009. So that was the year before. Okay. Now, about half of the office-based physicians surveyed said that they use a system that qualifies as a basic system, and that was in 2006. Almost 70% of office-based physicians noted their intent to participate in the EHR incentive program, because of course there was an incentive attached to taking on an electronic health record system. The adoption of EHRs has been very slow. Issues or barriers for adopting an EHR, it had to do with cost, uncertain return on investment, and not a one-time event. It needs ongoing testing and modification. Now, the HITECH Act became part of the American Recovery and Reinvestment Act of 2009, and also known as the stimulus. So the stimulus provides financial incentive to physicians and hospitals for the meaningful use of IT. Now, HIPAA, the Health Insurance Portability and Accountability Act of 1996, attached confidentiality concerns with the adopting of EHRs. So HIPAA makes it illegal to gain access to personal health information for reasons other than healthcare delivery, operations, and reimbursement. So this law mandated strict controls on the transfer of personally identifiable health data between two entities, provisions for disclosure of protected information, and penalties for violation. So usually when you want to send information from one doctor to, say, a hospital or to another doctor, you do need to sign off on it due to HIPAA regulations. Now, revisions to HIPAA under HITECH add more stringent rules for disclosure of breaches of confidentiality. So the inclusion of vendors and subcontractors who must comply with HIPAA requirements, restrictions on the use of these restrictions on the use of personal health information for marketing purposes, patient authorization related to the use of personal health information for research purposes, the use of genetic information for underwriting purposes by health insurance plans, and the patient's right to receive electronic copies of their public health insurance. So these were the rules that were put into effect when HIPAA was revised under the HITECH Act. All right, so I already touched on the restrictions regarding confidentiality and how the HIPAA regulations or HIPAA law was revised under HITECH. So we touched on that. And now I'm going to talk about health and the internet. So internet has continued to revolutionize certain aspects of healthcare delivery. Information empowers patients, which leads to changes in traditional patient-physician dynamics. That's for sure. We've seen a lot of these websites, WebMD, and so many countless others that are focused on informing patients. There's been a significant difference in the extent internet is used for health information based on whether users are satisfied or dissatisfied with the care they receive from their physicians. So dissatisfied patients use the internet as a primary source of information regarding their health. Even though, yes, it does open our eyes to many things, it really is a double-edged sword where there is the pros of taking it upon yourself to learn more information regarding health. But there's also the con where either the information you're reading is not credible, or you have these symptoms and you're thinking you have this disease that actually you don't have. So, it's very interesting. And of course, it has brought about the questioning of the physician, when you go in and he is diagnosing you and you're questioning everything you've read. But so it has definitely changed that relationship or the traditional patient-physician dynamic for sure. So terms to know. First, e-health, to all forms of electronic care delivered over the internet, ranging from informational, educational, commercial product to direct services offered by professionals, non-professionals, businesses, or consumers. And then we have mHealth, or the use of wireless communication devices to support public health and clinical practice. We also have e-therapy, so it's any type of professional therapeutic interaction that makes use of the internet to connect qualified mental health professionals and their clients. And I've seen this. It's very interesting and pretty effective. Then you have virtual physician visits, which are online clinical encounters between a patient and a physician. And this has become more common, especially for people living in rural areas and do not have access to a primary care physician. Some clinics, a lot of times even pharmacies, will have this virtual physician visit where you would actually speak to your physician through the internet. And telemedicine. So telemedicine employs the use of telecommunications technology for medical diagnosis and patient care when the provider and the client are separated by distance. So telehealth encompasses telemedicine, as traditionally known, and educational research, as well as administrative uses. Also clinical applications that involve a variety of caregivers, such as physicians, nurses, psychologists, and pharmacists. And I know that in this week's module, I do have videos that touch on e-health and telemedicine. Now, with telemedicine, it doesn't involve face-to-face contact between patients and providers, but it does enable generalists to consult with specialists located at a distance. So this kind of contributes to this coordinated care that we look for in the healthcare field. So now there's synchronous telemedicine, which is in real time, it's interactive. And then there's the asynchronous form, which uses to store and forward technology. So a lot of times this has to do with more teleradiology, okay? I just wanted to make sure to touch on the synchronous and the asynchronous types of telemedicine, which is in this slide. I didn't realize that it was in the following slide. Now here there is another video titled Telehealth, the Future of Medicine. Be sure to watch it. And remember, I do have videos in this week's module as well for Chapter 5. So the next topic I want to touch on is medical technology in relation to innovation, diffusion, and utilization. So we have innovation, which is actually the creation of a product, technique, or service perceived to be new by members of society. Technology diffusion is exactly what the term means. It's really the spread of technology into society once it's developed. So rapid diffusion of a technology occurs when the innovation is perceived to be beneficial. So it can be evaluated or measured. It's compatible with the adopter's values and needs, and it's covered through third-party payments. Now, technological imperative. So this is the desire to have state-of-the-art technology available and to use it despite its cost or established health benefit. So high-tech procedures are more readily available in the U.S. than most other countries, which is interesting. Now, almost all other nations have tried to limit, mainly through central planning, the diffusion of high-tech medical technologies or high-tech procedures. So they try to control the diffusion and utilization. One innovation created in healthcare delivery systems that the U.S. has lagged behind in implementing are smart cards, which is really a great medical technology. And what a smart card is, it holds personal information that can be accessed and upgraded at hospitals or physician offices. It can be used for holding personal medical information that can be accessed by your provider. So, if you go in to see your doctor or a new doctor and maybe you don't know your medical history very accurately, you have your smart card that has that information. Privacy concerns have been a major drawback with the use of smart cards, though. Cultural beliefs and values. So American beliefs and values have molded the nature of what healthcare delivery in the U.S. is today. In the United States actually leads the world in the development of new technology because of substantial outlays in research and development by both the public and private sectors. So the emphasis on specialty care rather than primary and preventative care leads to expectations by both physicians and patients that all valuable technology must be used, especially in the case of patients who are well insured. So other advanced nations such as Canada and Germany, they actually restrict technology diffusion and its utilization.